from families, staff, social workers, nurses. And the ironic thing about the whole thing is that the one thing that the executive office and the governor had focused on which is focusing on the facts and telling uh, and basing the decision on the facts. Uh, the one thing that he emphasized, he couldn't deliver, he couldn't get right. Sorry, just trying to. So the one and the fact that we've every day that we are hearing these numbers, the death numbers, people dying, the death tolls that are taking in our nursing homes and over the state, there's a certain level of psychological impact that when everyone is everyone is practicing being socially distant, and we're normalizing people dying on TV and social media every single day. We were already so desensitized as a society. Now we are beyond numbed because the numbers do not tell the stories. We all know that. The numbers don't tell the suffering and the trauma of our neighbors, our families, our friends, and what everyone is going through on the ground every single day. Um, so I think there is a design intent here to constantly let the public and the media to just focus on these numbers and not focus on solutions. And obviously, this is unacceptable. This week, I think by now many people already know, we had a constituent whose daughter reached out to us a few days ago. She traveled out of state after hearing that her mother's roommate at a Flushing nursing home had passed away from COVID-19, and she couldn't get any answers. She didn't know if her mother was safe, if they've moved her to a different room, if she was tested, if the staff members have all the safe equipment and making sure that they're practicing social distancing. She couldn't get anyone to call her back, and she came back to get answers. And the one mandate that we had as a team all week was to treat this daughter's mother as if she were our own mother and our own mom, and proceed as if our own mother's lives depended on what we did this week. So we went to talk to as many people on the ground, the nursing home. We spoke to the governor's office. We went to see the mayor's office and just tried to get simple, basic answers. And during this time, we discovered that it wasn't just her. There were hundreds, if not thousands, of other family members who were stuck in the same exact situation as my constituent was all week. Behind every loved one that's stuck in a nursery home tonight who has been exposed to COVID-19, there are families that are home stressed, worried, and not sleeping at night. They're reaching out to as many people as possible. They're calling nonstop, leaving voicemails, text messages, you name it. On social media, they're reaching out because they're desperate. Like, how would you feel if you knew that your family member has been exposed to this deadly virus? They already had an underlying condition, and you're not getting any answers. So tonight, I know that so many people had reached out looking for answers, and on behalf of the state, on behalf of the city, and everyone involved that led up to this moment, I want to first and foremost apologize to all those listening in and all those people who reached out, because there is a colossal failure and governmental mistakes were made that led up to this moment. We didn't have enough safeguards. We didn't have enough protection. There was no safe staffing in place in the nursing homes, even though the state assembly passed legislation year after year. The industry rejected the notion of having minimum nurses in nursing homes. And the state could have done more. The Department of Health, for weeks leading up to this moment, all they did, even though they have plenty of staff members that could have done more, is call these sites every single day looking for data for daily press briefings. They even failed to get those numbers accurately, and that's the irony of it all. That they focused on getting statistics and getting how many people died every single day instead of calling every single day and figuring out what the needs were on the ground and allocating the PPEs and all the equipment and whatever it is they had to do early, 3, 4 weeks ago, beginning from March, to get into these places and protect the most vulnerable members in our communities. We all know that individuals with underlying conditions are more susceptible and more vulnerable to the coronavirus. Everyone on the planet knew this by the time it hit New York, but yet we let this happen. So I'm very, very disappointed in the outcome and what we're dealing with at this moment. Um, I know that I apologized on behalf of everyone involved, uh, and I feel very sorry that this is happening. But because I feel sorry because I completely empathize with all the pain and sorrow that I'm hearing, because this is something very personal to me. Uh, just yesterday, I found out that my uncle, who has been in a nursing home in Flushing, passed away. He was in the nursing home for 7 years. He had dementia, and he passed away. And we'll probably never know if he had COVID-19. Uh, he wasn't tested. He was fine a month ago. My father went to see him a month ago before he was practicing social distancing, and apparently he started losing his appetite a few weeks ago and became sick. But other than that, I still don't have any details or answers uh, as to what happened and if he was tested and if he wasn't tested and how did we determine the cause of his death. Um, my uncle. I'll just take a moment to talk about my uncle Song Kim. He died at 2 days ago. He was 79 years old, and to some of my friends who are listening uh, in my circles, you heard about my uncle. He was the first dentist um, from the Korean community to really be in mainstream practice from Flushing. He graduated from Seoul University and came here, went to NYU Dental School and joined the Army and became a captain in the Army. And that's how he launched his dental practice, doing dentistry for the military. It was him that was responsible for sponsoring my family, my parents, to come to this country. If it wasn't for him, I wouldn't be here. I would not been able to become a U.S. citizen, um, run for office, and represent the neighborhood that I grew up in. And one funny story that I've often told now, I'll share publicly, um, is that the reason why I got the name Ron, my full name is Ronald. Uh, Even though I like to tell people that I was named after Ron Darling, it actually was because of my uncle. My uncle named me after Ronald Reagan. Um, he not only was he one of the first dentists from Flushing of Korean descent, he was also one of the first Republicans at the time of Korean descent in Flushing, and he was a big fan of Ronald Reagan. And I joke around because I spent my entire adult professional career as an elected official undoing all the damages that Ronald Reagan has done for this country in terms of prioritizing monopolies and trickle down economics that have ruined small businesses and local communities over the last few years. But I am, I share a deep sorrow, just like many of my constituents, as I reflect on his life tonight and how he lived his life. Um, so let me just take a moment to also read um, some of the emails, voice messages, and concerns, the endless messages I've been getting from my uh, constituents and people around my neighborhood about their personal experiences going through the tragic deaths around the nursing homes and waiting for answers from their about the loved ones who are stuck in nursing homes. And again, these stories are to me what is the truth, not the data, not the numbers that we're seeing on TV. So here's one. We don't know the circumstances around my grandmother's death. Sapphire, the nursing home, wouldn't tell us more than a lot of people died this week. But we do not know that they had assigned a social worker to call us once a week to told us my grandmother was doing fine, was eating and doing well. When we heard that she died, a nurse told us she had stopped eating and sleeping since the facility was closed to visitors 4 weeks prior. Another one. I've heard from reliable source from inside New Franklin Nursing Home in Flushing, Queens, that there are over 100 deaths from coronavirus, not the reported 44 deaths. Supposedly, every resident on the third floor has died, and they're using the third floor as a makeshift morgue. Here's a voicemail that I translated. I was calling regarding my father. I know you would know about him from Sapphire. Please give me a call back. My father passed away. If you don't, and they won't perform any test on him, and we will never know and prove that he died of coronavirus. Please give me a call back. And there are also many other people like this constituent whose loved ones died of all the symptoms, but will never test what they were never tested, so they could never claim that they died of the coronavirus, and that's a serious issue that we need to figure out how to resolve. And we can say we assumed or presumed that they were coronavirus, but there are hundreds, if not thousands, of others that fell in the cracks and were their deaths were attributed to something else besides coronavirus that we may have to go back and rectify because their families are very angry. Here's another one. Uh, how can I find out about many residents at this home about COVID-19? They are confirmed COVID-19 cases there, and her floor as well. Can you help me? How can I get her home and tell me how many cases are there and how many people died from COVID? So again, I'm spending as much time, obviously, on a Saturday night and beyond, trying to get through the emails, trying to respond to as many people as possible, and trying to get to the truth of what is going on and share that truth to the public. And that's one of the first thing that is so critical and important during this process. We need honest and frequent communication with the families. Whether it's good news, bad news, outbreak, we just need honesty, and we need someone to pick up the phone, return their calls, and tell them exactly what is going on. And families need options. There were some people that were somehow figured it out and went to get their loved ones out of the nursing home. Others have called me and said they didn't realize that was an option. They didn't realize that they could have saved their loved ones if they took them out 2, 3, 4 weeks ago. No one told them anything. And last two things, I think everyone by now knows this. We need to test everyone, staff members, every patient in nursing homes. Not only test them, we need to start tracing, tracking, without sacrificing their privacy. And we also need to figure out how to implement antibody tests to the nurses and staff members who might have had already been exposed, but now we should know if they grew the antibodies in their system. And all those things are so critical, and we must get it right. And lastly, PPEs. I know that it's late we dropped the ball on purchasing the PPEs as a state. Other states other governors have acted early and used their purchasing power and figured out how to raise revenue and did whatever they could to get as much PPEs and distribute them to the nursing homes, hospitals, prisons, homeless shelters, wherever it was necessary. In New York City, in places like Queens and Brooklyn and other boroughs, we were left for us to figure it out on our own. We have to, for weeks, rely on the generosities of individuals, of wealthy individuals and companies and nonprofits and any other people who we can source some of these protective gears from. And that's not right. If we acted sooner, and if we were able to get enough PPEs and distribute them to the nursing homes and all these other facilities, we could have avoided thousands of unnecessary deaths. But right now, there are thousands of other people at the nursing homes that we need to figure out how to save. The COVID-19 is still rapidly spreading. I'm not confident at all whether the nursing homes have their act together. I know the Department of Health finally started sending inspectors to some of these sites last week. I still haven't heard what the reports look like. I'm not even sure if the inspections at this point were just for optics and trying to just do damage control, or are they coming out and offering real solutions? And to be honest, I'm not even sure if they're able to execute on the solutions that's required, which is delivering PPEs and doing massive testing. And I say that because every time the topic of testing comes up, our leaders, and especially Governor Cuomo, he continues to shift the blame on DC. Where's my funding? Where's my money? Where's this? How come you haven't provided enough testing for us? If revenue is a problem, we should have focused on revenue for the last couple of months, especially when we were doing our budget. We should have figured out how to raise billions of dollars, and we should have purchased all the equipment and distributed them to our people. Even now, it's not too late. I know that this is a topic that we started to bring up with some of our colleagues, the governor, the speaker, and the controllers in New York. The Federal Reserve gave us a gift last week. They changed their regulations and their rules for the first time, allowing localities and states to act as de facto federal agencies. What does that mean? It means that instead of thinking with an austerity mindset, we can think with more of an abundant mindset because we are co designing and co allocating where the new printed cash can be allocated. In other words, it's called quantitative easing. It was always meant for federal and commercial banks, but now localities, through what we call a community quantitative easing (QE), we can actually be a partner in printing new money and making sure new cash is flowing to our communities and to places that we need them the most. So there is no real need to cut any programs. There was no need for us to cut Medicaid, healthcare, summer youth employment programs at the city level, social services. What we need to do now, during these daily press briefings that we're seeing on the news, is announce a task force that will work directly with the Federal Reserve and put in the financial mechanisms as a city and state to make sure that we are there when new money is being printed and we are allocating and getting as much money of that back into our communities. Again, there are other solutions that we will be introducing in the coming days. We're working very closely with the Speaker's office and the Assembly on a legislation specifically to focus on instituting better measurements to safeguard our nursing homes. And I look forward to introducing that in the coming days. Thank you.